Doc on the Run. We help injured runners run.
All right, so let's talk about self-diagnosis of Achilles tendonitis. You have to try to figure out if there are any tests or anything you can do to determine whether or not you're having true Achilles tendonitis. The truth is, most runners don't need fancy tests in order to make a diagnosis of an Achilles tendon issue. If the tendon is sore after you run, you have some sort of Achilles tendon problem. Now, x-rays are not useful in making a diagnosis of Achilles tendonitis, so there's really no value in those. The only question is whether you have paratendonitis versus true Achilles tendonitis versus Achilles tendinosis, or worse, a partial rupture of the Achilles tendon. Although many doctors will do ultrasound or order an MRI, and of course you have to pay for those tests, the majority of us can truly tell which of those conditions might be bothering you just by hearing your story, touching, squeezing, looking at your Achilles tendon, and making a decision just based on the way the tendon feels. It's not really that complicated. This is so simple, in fact, that in most cases I can walk a patient through this process on Skype during a virtual doctor visit. If you understand what to look for, you can even do this yourself. Part of the self-analysis is trying to think back and determine whether or not you have done anything in training that may have caused a problem with the Achilles tendon. You have to think about what medications you've taken. Did you take any new medications a month or two before you started having problems? You have to understand why Achilles tendonitis can occur in the first place. Achilles tendonitis occurs because too much stress is applied to the tendon before the strained tendon has fully recovered from the preceding workout. When I lecture at medical conferences, primarily to rooms filled with foot and ankle surgeons, sports medicine podiatrists, and orthopedists, I argue then, and I maintain here, that running does not cause Achilles tendon problems. I also don't actually believe that faulty biomechanics even cause Achilles tendon problems, unless you consider or say you develop poor running form or faulty biomechanics as your running form falls apart at the end of a long run. If that happens, it's not because you're faulty per se, it's not because you're somehow defective, it's because you're too weak and too unstable to maintain good form during that specific workout. In that way, weakness and instability results in the degeneration of your form in a way that delivers abnormal stresses to the Achilles tendon. It's really mistakes in training that cause injury. My main contention when lecturing to physicians is that running does not cause running injuries. Training errors cause running injuries. For most of us runners, if you were to decide to do hill repeats every single day for the next year, I'd be willing to wager that the overwhelming majority of you would become injured. And most of us would not take a year to develop that injury. But that would be a training error. That isn't faulty biomechanics. That's just doing something foolish, and it's going to apply too much stress to one specific structure before it can recover from the preceding workout.
Doc on the Run. We help injured runners run.